Change is hard. Think about something that you are trying to change right now. Maybe it's the amount of sleep you're getting, how much you're exercising, or the dynamics of your personal relationships. In all of these scenarios, the one constant is that you have to be ready to take on that change in order to make it stick. This idea also applies to your loved one who may be showing signs of depression. While it may be clear to you that this person needs to make changes and seek help, your loved one needs to make that determination on their own and at their own pace. This difference in perspective may leave you feeling helpless and frustrated at times and may make interacting with your loved one difficult. At Families for Depression Awareness, we believe that family caregivers can play an essential role in supporting a loved one in getting well. In fact, your observations about behavior and knowledge of family history can help clinicians in diagnosing and treating your loved one. We want caregivers and family members like you to appreciate the process of making change so that you can increase empathy for your loved one while decreasing your level of frustration with the situation. To better grasp that process, it's helpful to apply the stages of change model. In this video series, we'll examine the 6 stages of change. By the end of the series, we hope you will have greater knowledge of the process your loved one is going through, how depression impacts their ability to make change, and what you can be doing as they move through the stages. The 6 stages are pre-contemplation, contemplation, preparation, action, maintenance, and relapse. The pre-contemplation stage can be described as, I'm not thinking about making a change or even the need for it. During pre-contemplation, you probably have thought that something needs to change in your loved one's life, while they have not. Contemplation comes next. This stage is the I'm not sure if I need to change stage. Your loved one may begin to see the need to change a behavior, I'm tired of being tired, but is not actively working on it. Preparation, also considered the I'm working on changing and have taken some small steps forward stage. This stage is important for identifying your loved one's motivation for change. During preparation, they may begin to ask for help or guidance, or share the reason they would like to change. Action, which is the I'm changing stage, is when your loved one is actively engaged in change. There are many actions that could occur during this stage that will help on the path to wellness. In the maintenance stage, your loved one can proudly say, I'm changed and I'm sticking with it. They have headed toward or have achieved some level of wellness. The final video covers relapse. We often hear the word relapse as it relates to substance use. In the context of the stages of change, relapse refers to when a person re-engages in unhealthy behavior or abandons positive changes they have made. While this can be a discouraging point in the process, it is also an opportunity to build on the changes that worked and modify those that did not. Making behavioral changes isn't necessarily a linear, forward-moving process. Instead, as your loved one works through the stages, they may move from action to inaction, from recognizing the need for change to denying it, from getting better to possibly relapsing. Remember to give them the time, space, and support they need to make lasting changes. Having your own personal support system during this time is important, if not essential, to your own well-being. In addition to having social support from family and friends, having your own therapist can help you process your emotions around your loved one's behaviors and set appropriate boundaries as they work towards change. We hope that learning about the stages of change will help you maintain a healthy lifelong relationship with your loved one. Thanks so much for watching. For additional resources, visit Families for Depression Awareness at familyaware.org.